I mean, first of all, I would say that CDC in this case has done a very good job at controlling the measles outbreak. We've had about under 700 cases nationally, and in Europe they've had 127,000 cases, 37 deaths. People get measles because they don't vaccinate. They get measles because the vaccine wanes. The vaccines wane about 4.8% per year. And so, that it's a leaky vaccine, and that problem is always going to be around. We need to also make sure that doctors know how to treat measles and how to treat the associated diseases, the pulmonary disease that often come with them, and bacteriological. And we can't rely simply on the vaccine. We also have to know how to treat measles. Children shouldn't die of measles. When I was a kid, before the measles vaccine was introduced, there was 500,000 people who got measles, as many as 2 million a year. And nobody got in the newspapers for that. But the death rate was about 400 people a year, mainly children who were malnourished. So it's a infection fatality rate of 1 in 1,200 to 1 in 10,000. Healthy children should not die of measles, and there's no reason they should. If the doctors know how to treat at the hospital, that will not happen.
Wait a minute. Any other questions for Dr. Oz or Secretary Kennedy?